Welcome everyone. My name is Prashant Yadav. I'm a senior fellow at the Center for Global Development and affiliate professor at INSEAD. Sorry for the delay in getting started. It took us a few minutes to get some of the technological things sorted out. Welcome once again. This event is about how do we make use of new technology, especially drones, to deliver supplies that are critical for COVID-19 response. We have a wonderful speaker, Brittany Yunchon from Zipline. She has public health at Zipline. Just as a quick background, I think we've seen drone technology being used for a number of applications, both in low and middle income countries and in high income countries. And some of those include delivery of medical products, blood components, plasma, and other health products. And we've all been asking questions as to where is this applicable, what kinds of products, what kinds of therapeutic areas, how can we build a better platform so that this technology can become more mainstream. And there have also been questions about, are we ready yet? Is the technology ready yet? So Zipline has been running a national scale program in Rwanda and have recently started in Ghana. And that is more to deliver routine health products in normal circumstances. But the value of creating a structure like what Zipline is doing in Rwanda and Ghana is also that in times like COVID, we can leverage a platform like this to deliver supplies which are needed with very fast response or short lead times. And that's what we want to hear and discuss today. The way we've organized this session is Brittany will present some of the findings from their work in Ghana. She'll also share with us some live videos of their work so that we can see how it works in practice. And then we'll have time for discussions and questions. And I also encourage you to post your questions through Twitter and other social media streams. We'll have ample time to discuss and answer questions. So with that, I want to pass on to Brittany. Brittany has, currently she's the head of global health at Zipline, but before Zipline, she's worked with many social impact investing organizations. She has an illustrious career in this field. And at Zipline, she works very closely with national governments to help them think about how can new drone technology help them create better delivery systems. So Brittany, welcome to the Center for Global Development, and floor is yours.
Thanks, Prashant. Great, okay, can you guys see my screen yet? Okay, great. I'm looking forward to sharing how Zipline works under normal circumstances with this audience, and then also how we have been adapting our service in the last couple months to be able to support the governments of Rwanda and Ghana in their response to COVID-19. So Zipline operates an on-demand drone delivery service to be able to make emergency and essential medical products available to anyone who needs them in any corner of a country. Our mission is to provide every human on Earth with instant access to vital medical supplies. And we have started that path first in Rwanda and now in Ghana. So just briefly, the way that our service works is that we establish distribution centers that serve as the hub for a region. These distribution centers are part warehouse, and part medical warehouse, where we are actually storing our customers' medical products, and then part drone port, that can then be connecting those medical products very quickly to the vehicles that can transport them to the health facilities across that region. Each one of those distribution centers serves a service area of over 22,000 square kilometers. So depending upon the size of the country, you only need a few of them to cover them. So in Rwanda, we need 2, and in Ghana right now we have 4. We'll get into that in a bit. So The core of our technology is our Zip, which is our autonomous drone that has a service radius of 85 kilometers. So we can be making one-way deliveries of medical products from our distribution center to any one of several hundred health facilities that fall within that radius. As you can see on the belly of the plane, there's a hatch. And that hatch holds a package of medical products that are kept in cold chain conditions if necessary or and appropriate for that product. And the plane will actually autonomously release that package when it has arrived at the health facility and deliver it into a pre-designated what we call mailbox that's right outside that health facility's door. So, of course, we are occupying airspace. This is a highly regulated way to be operating. We work in the intersection of healthcare and airspace integration. So we do communicate very regularly upfront and on an ongoing basis with the civil aviation authorities in the countries where we operate. They have real-time visibility into where each of our vehicles is at any given point, and we can have up to about 20 vehicles be serving across a service area simultaneously. And they are flying, as you may see on the right-hand side here, they're flying on these pre-approved routes that the authorities are telling us are appropriate for us to be flying on. And so in that way, the plane knows exactly where it's supposed to be going. You can imagine it is almost an invisible subway tunnel in the sky. And so it's going to be flying directly on that path, making its delivery and coming back. And we do this over and over again with many deliveries, 7 days a week, 12 hours a day across multiple distribution centers. So why are we doing all of this? Of course, as I mentioned up front, our mission is really around healthcare. So we believe that we can be helping systems to bring universal health coverage to some of the places that have been traditionally hardest to reach. That, of course, you may think of urgent on-demand delivery as being equated with emergencies, and it is. We started with blood in Rwanda, but have expanded since then to include the full range of emergency and essential medical products, recognizing that any health facility should be able to have access to any treatment that is appropriate for it to be administering. And that may be resolving stockouts or making things available on a just-in-time, as-needed fulfillment basis. As I mentioned before, we do guarantee cold chain down to the last mile, which frees up a lot of these last-mile health facilities from not having to have cold chain storage on site. And all of this, ultimately is serving some of the smallest and hardest to reach and most remote health facilities in the same way that it is serving those that are in more peri-urban areas. And so, we believe that where you live shouldn't determine whether you live, and our service is helping to level that playing field across health facilities. Of course, these are some of our value propositions during normal circumstances. Today, you're going to be hearing about one that is much more specialized to where we are today, and that is how can we be helping to support health systems during times of outbreak. So we'll have the whole second half to go into that. Just briefly, we did start our service for the first time in 2016 in Rwanda, where they were the first country to embrace national scale drone delivery. Today we have 2 distribution centers that serve all of Rwanda, serving hospitals and health centers. That service has historically been very focused on blood and more on emergency deliveries than in Ghana, which we expanded to last year. In Ghana now we have been operating since April 2019. As wasn't the case in Rwanda, this is really a public-private partnership that has existed, that has been championed by the government, and they pay an ongoing service fee to Zipline for our service per distribution center, same as in Rwanda. But there have been upfront development partners that have helped to catalyze this, including Gavi, the Gates Foundation, Pfizer, and UPS Foundation in Ghana. And with this, basically, we can be putting in the infrastructure to be having this service run on top of it as a platform. So in just 1 year, this service has launched 3 of those 4 distribution centers. And the one that's in the farthest southwest is actually launching next week. So then we'll have all 4 up and running. And you're going to be hearing a lot of stories about how this has been made, much more agile as the country is thinking about COVID response. So at this point, actually, we're going to transition to a quick tour. It is about 5 minutes long. I will prepare everyone, but this is actually a tour that was given live of one of our distribution centers. It's the one right in the middle of the country, and this was a Facebook Live tour for Zipline Ghana's first anniversary a couple weeks ago. So you're going to be hearing from some of our staff there, explaining how the service works on an ongoing basis, and I think that will really help to set the stage for then what we'll talk about next, which is how this has been pivoted for COVID.
Hi, my name is India. I'm a fulfillment operations professional here at the Zipline in Pena Distribution Center. Zipline in Pena is about 1.5 hours from Kumasi by road, and as a fulfillment operations professional, I interact with our customers and ensure that they have the best experience that they can have with Zipline. Before Zipline, some hard to reach facilities were actually having challenges with getting medical supplies, either because of inaccessible roads to their facilities or the rainy season made it very hard to reach them. With Zipline, such facilities are able to get blood and medical product supply in a matter of minutes. So Zipline stores a wide range of products here. We have products ranging from essential medicines for life-threatening conditions to vaccines, to infusions, and then blood products as well, componentized blood units. For those products that don't need any special condition for storage, we arrange them here on the shelves. But then for the cold chain products, we keep them in the fridges, which we'll go to a bit later in the tour. So now let's get into the real action. So this is the order taking station, and this is where most of the communication with the clients takes place. So this is Michelle, who is taking orders today. Hi. So what Michelle will be doing today is receiving orders from the facilities, either through WhatsApp or a phone call, a text message to a toll-free number that we use. And when she gets the order, she takes information about the products that they need and the quantities that they need. She puts it in this special fulfillment system. And then she also communicates to them on the progress of the order that they've placed. So by looking at this interface, she's able to see the drone in flight. So she knows exactly where the drone is at any point in time. And she's able to notify the facility when the drone is about to deliver or is close to their facility. This is Victoria, who is order packing today, and still in the same system, Victoria is able to see the products that Michelle entered and the quantities that she needs. So what she does is she picks the product and scans that unique ID that we put on it earlier when we were receiving. And the system tells her if it's the right product, if it's the right expiry, and everything about the product. So this is what our package actually looks like when it gets to the health facility. It has this air insert in it, and this air insert kind of breaks the fall when the package is dropping at the facility. It also has this really cool parachute that deploys once the package is released from the drone, and then it lands very gently to the floor so that the facility can pick up the package. Once the order is placed in, the order packer pulls the blood units from the fridge and then comes to the blood packing station. He weighs the units to ensure that it's within the right weight range for the flight. He does a visual inspection of the blood unit to ensure that there are no clots or the blood does not have any defects. When he's satisfied with his inspection, he goes ahead to scan the unit and then scan the package to assign this blood unit into this package box. Then he wraps it in the insulating paper and then puts it in the box. And then he hands it over to the flight operators.
My name is Tracy, as Indira said, and I'm a flight operator here at Zipline. Flight operators, what we do is that anything that has to do with the drones we are in charge of it. So come along and let me give you a tour of our flight ops area. So Kwame is going to scan this QR code on the package and scan the QR code on the body of the zip. So let me show you. This is what the body looks like. So after scanning the QR code on the package, he's also going to scan the QR code found on the drone, so that we know that this drone is carrying this particular package, and also to inform this drone where it's supposed to deliver at. So the location of the delivery site is embedded in the QR code found on the package. Insert the package into the body of the drone and gently close the doors. Before we launch any drone, we have to assemble the drone. We have to assemble the body, the wing and the battery to form a fully assembled drone. So it uses our software to do all those checks to ensure that everything is right. Then it will announce to us that we are ready to launch.
Spinning motors. Launch of the flight 250
Also, the controller communicates with the Ghana Civil Aviation Authority, who are aviation regulators, to ensure that if there are any restrictions that they have concerning our flights into certain areas, we are very much aware of it. So the controller communicates with GCA, ensure that everything is right. And then also the controller monitors our flights when they are leaving. So if there's anything that is going to happen to any of our flights, the controller is the first point of contact.
Recovering in 34 seconds.
So thank you for joining us. Bye.
Hi, my name is India.
Okay, I hope that helped to really kind of bring this alive for you. I think sometimes it's hard to understand what a national scale drone delivery network looks like. And there, I think you can see the scale of the warehouse, the scale of the flight operations. That distribution center is serving hundreds of facilities today. And now it is serving those facilities for not just normal healthcare services, but also for COVID. So getting back to the slides. So COVID has required our customers to change the way that they operate their health systems. And as part of that, they are looking to us to change some of the ways that we can serve them. And they're looking to us as a responsive and flexible platform that they can be using to fill some of the new gaps that may be arising from quarantine and restricted movement. So you can see in the middle of this slide, some of the central tenets of our system actually can help to slot in and meet some of those challenges. And I'll talk through some of these over the next slides and show you some real-time examples. So in Ghana, for example, some studies that we have been doing in partnership with ID Insight and LLMICs, sponsored by the Gates Foundation, have been looking at how does the Ghana health system work, and how does Zipline's solution kind of layer on top of the Ghana health system. And one of the things that research has flagged is that two of the key backup options that the system currently exercises when they need to be thinking most efficiently, or when things go awry or don't go according to forecast under normal circumstances without Zipline, are being able to fill gaps in product through the supply chain, being able to go and pick up, and then also by being able to refer patients to another facility when needed. Of course, restricted movement and the lockdown that started on March 30th in Ghana really began to bring into stark relief that sometimes these options aren't available. So just to show you a bit of the data from this, so before COVID, this research was showing that about 55% of the health facilities that were studied didn't have on-site cold storage. Normally this would mean that a health worker would go and pick up the vaccines, on the days that they would need them for their immunization campaigns. During an outbreak, that might not be possible. And so how do you make it so that that health facility doesn't have a gap in immunization, and that community has a gap in immunization for the duration of an outbreak? Similarly with blood access, normally when people have emergencies in the Ghana health system, it's quite normal to go and kind of find volunteers to be able to donate blood. And that is not possible when everyone is sheltering in place. So these are some of the ways that it's bringing into stark relief that these health facilities need to have on-site access to medications, vaccines, and blood in order to be continuing the care that is required of them. Now, similarly with referrals, there is a pattern of referring patients to upper-level health facilities or to close-by health facilities, in the world without Zipline, when a health facility is missing some of the medical products that they may need to appropriately provide care for that patient. So here you can see that about 40% of the facilities that were studied showed that they do tend to refer patients if they have a stock out, and that is not going to be possible in times when there are restricted movement policies in place. And then similarly, particularly in an emergency, if you have an instance of a snake bite or you need rabies vaccine, these are oftentimes products that are not held on site for a variety of supply chain reasons. And so, how do you make sure that that patient can get the emergency care that they need at the facility where they are? So some of the other ways that we are kind of chiming in here. So first and foremost, you need to be able to respond safely. So Zipline is holding emergency stocks of PPE and other response items across the region. So for those 3 distribution centers that are already up and running, we have stocks of these items that are on our shelves and ready to be deployed to those health facilities, either when the health system tells us to or when those health systems request them. These are some of the examples of the PPE, for example, but then also things like infrared thermometers. This, of course, means that you need fewer units of those. We know that PPE is scarce, so you need fewer units of those if they're held centrally, and you are just making them available, whenever someone kind of raises their hand across one of several hundred health facilities and says, we need some here now. So what we're also doing is helping to make sure that important services like immunization and other essential medical services aren't interrupted. So the Ghana Health Service has asked us to step in and be serving as the primary supplier of many of these products. So here's an example of vaccines. So this is Zipline's vaccine delivery week over week for all of the weeks of 2020. You can see that right after week 13 was March 30th, which is when Ghana implemented its lockdown. That following week, our system was able to accommodate a 4x boost in demand from health facilities by shifting from ground transport to drones. And of course, here you see a quote from Seth at Gavi, who's one of our key partners, about how critical it is to be keeping these immunization services on, particularly with conditions like measles and polio. You're seeing in different regions that there could be some massive collateral damage, unfortunately, if those immunization services are stalled. So if you actually fast forward a few more weeks, you see that this same pattern happened again. So this was actually just last week. Last week, what we saw was that there were several major facilities in our service areas that suddenly were ordering big volumes. And so we dug into the numbers. And what you can see here is that There's a small number of facilities that were ordering a lot. Those are bigger facilities that were actually restocking because they had started to run out and they had some planned immunization drives ahead. And then there was a whole long tail of really small facilities that only needed a little bit, and actually really only needed about 3/4 of them only needed enough to be put in one Zipline box to sustain them for the week. So this is a way that we could be stepping in to actually be complementing or replacing ground transport. You see the same thing when it comes to family planning. Of course, and really any kind of a medical service. If there is a gap, then what happens in the absence of that service? These are some unfortunately very dismal figures that are coming out of Marie Stopes International in Kenya and India about what the impact of not having family planning services could be in these health systems. So I'm really delighted to say that we are actually at the Ghana Health System's request going to be delivering family planning products and other sexual and reproductive health products because we are basically stepping in and being the primary supplier to many of these smaller clinics that we're rolling out to. So they have said just deliver anything that they need. And of course, one of the things that they need at this primary point of care are family planning services. So we hope to be able to help to avert some of those outcomes. In Rwanda, there is a different example. This is more about specialized treatment. So we have established a partnership with Partners in Health over the last couple months. So here you can see at the top of Rwanda, I've pointed out where Butaro Hospital is. Some of you may be familiar with it. It is a world-class institution that Partners in Health has set up that draws patients from across Rwanda for specialized care, including cancer treatment. And so they realized that their patients were in a situation of lockdown. They were going to be unable to get there, and it was also going to be unsafe for them to get there because of their compromised immune systems. So they turned to Zipline to actually help to bring their cancer treatments, their oral cancer therapies, to those patients closer to where they live. So we are now serving up to date about 44 cancer patients, bringing their cancer delivery, their cancer medications to them. And then finally, sample transport. So this is one that we developed really, again, at the request of our customer. They recognized that they had an issue with distributed low volumes of tests that were happening at the health facility, the health centers, and in other more remote health facilities across the country, where those health facilities were actually batching, trying to wait and batch, wait to test patients and then batch those samples because they didn't have access to ground vehicles, or it was just a very long drive to be able to actually get into the lab. At the beginning of COVID, there were 2 labs that could handle COVID tests. They are now bringing up at least one other, and our first, second, and third distribution centers will be able to serve as collection points now to take it so that those health facilities no longer have to be arranging expensive and long and scarce ground trips to go that long way to the lab, but instead we have partnered with the Ghana Health Service to be able to actually arrange for Ghana Health Service to pick up, or for those health facilities to drop off at our distribution centers, and then we can be relaying them into the labs. And this is extraordinary because, as you can see here in this map, this is a view of our flight map in right outside Accra. That blue area is a dense urban spot. And so for the first time, we are actually delivering into an area that was previously known as kind of a keep-out zone, dense population and secure airspace to make those deliveries to the labs. And so again, we're doing that at 2 distribution centers now, and we'll be doing that soon from a 3rd. Just to wrap up here, I'll leave it with the former Director General of Ghana Health Service. Dr. Anthony Nsia-Sari. He just has a short message kind of reflecting on how they have been integrating our service into their response.
Zipline has come so handy, especially during this period of the pandemic of COVID-19. Now we are using Zipline, most of the facilities are using Zipline on that, moving from place to place, looking for personal protective equipment, and also sending samples. So samples are sent to the Zipline distribution centers, and they are delivered directly to the testing centers. The same thing of personal protective equipment, which are given to Zipline, because most of the institutions that they cover don't need very large volumes of personal protective equipment. And even if they need it, they can go several times and deliver it as and when they need it. It is helping us in the social distancing, that we don't have a lot of people moving to the regional medical stores looking for items. It also cut down the traveling time for a lot of the state health directories and the hospitals in charges. It has made the work so easy for them. They are working remotely and they are taking care of patients that they have to see instead of traveling long traveling hours on sometimes rough roads. So by so doing, Zipline is assisting us during the COVID-19 pandemic to practice social distancing and also to cut down unnecessary contacts, especially in vehicles. And we are hopeful that together with Zipline, we shall not only flatten the curve, but we shall actually break the curve and then make sure that we have zero pandemic in the country. So we are very thankful to Zipline for all what they've been doing, and I think that we will continue working together and have a very robust health systems in place so far as logistics management is concerned.
So that's it from me.
Thanks, Brittany, and thank you for also giving us almost a real tour of both your distribution center and also comments from the colleague at Ghana Health Service. And on one side, it appears very futuristic to assume and believe that PPE and lab supplies could actually be delivered or brought back using drones. But you've shown us that you are doing this and doing this at large scale in Ghana. Are there unrealized opportunities, potential that we're not tapping onto, and are there areas where we could use this platform to do more, both for COVID-19, but also the kinds of things that you described, such as shortages of vaccines, family planning, and sexual and reproductive health products? Are we missing opportunities? That's the first. And the second is, I'm sure many countries are asking the question, well, you have this in Ghana, you have this in Rwanda, you probably are starting in other places. How do we get to it, and what sort of factors go into determining where you operate or where others can convince you to operate, things like that. So any thoughts and insights you can share on that? And for our audience, any questions, comments, critique, discussion items, please share them and we'll bring them up. So over to you, Brittany.
Yeah. Great, thanks, Prashant. There are certainly things that we have, that have already crossed our minds of ways that this platform can be applied to be strengthening health services during this time, as well as in other times. So just a few that come to mind immediately. So we unfortunately have seen some of the analysis coming out about the potential lapses in access to TB treatment and HIV treatment. There could be devastating results if those patients are not able to get on treatment or have interruptions in their treatment, and it is creating resistance. So we could certainly be helping to bolster some of the access to those sorts of commodities, helping to make sure that those patients who, in some instances, I think in the best of cases, were given a few months supply, but in some instances maybe they didn't have that kind of extra stock to be able to give those patients that supply. And so how can we be making sure that those patients are receiving their treatment similar to how they are with partners in health with the cancer provision? Another one is, you can imagine, all of the data that is flowing through our system. I mean, here, you saw just a quick cut of that with some of the vaccine data, but you can actually think of, by being able to have a real-time sense of what is the demand for different things across the system in any corner of the country, what are some of the dots that you could connect if you had that actually acting as a bit of an early warning system in these sorts of times to say, actually we're getting a lot of requests for PPE or a lot of sample transport that's popping up in this corner of the country where we hadn't seen that before. What does that mean? And to try to, connect that with some of the other ways that the health system can then go and check up on that. We may have actually the front lines in terms of being able to spot those. And then finally, the one that is, really, I think the question that is looming over all of our heads, this collective challenge of how do we think about being able to distribute COVID-19 vaccines. When that is, when those are going to be discovered and manufactured, how do we make sure that they get to everyone in all of the countries that need them? Many of those patients may be remote. It requires cold chain. These are going to be scarce products, and so there's a lot there to kind of think through of like, how do we as a global community get ready to be able to make that happen and urgently? So that's kind of other things that we could be doing. In terms of how to, how other countries can get involved, I mean, really, it is a collective effort. It's a coalition, but it starts with the Ministry of Health. And so when the Ministry of Health sees that this is something that resonates with them, then the next sets of the government that we and they should be looking to, make sure are supportive are the executive branch. And then, of course, the Civil Aviation Authority. And we're happy to lead those conversations. But those are the places where these things can sometimes get a little bit hung up. And then, of course, those countries can be turning to some of their development partners to see who is supporting health system strengthening and COVID response. And it may be through a vertical approach, like some of the verticals that we've mentioned here, or through more of an infrastructure angle, and being able to help make the health systems more resilient. And so when you bring together those different partners, a project can move quite fast.
Yeah, so I think a couple of questions that are coming up on Twitter and other social media, and also is a question that I wanted to pose. One is, with COVID-19, governments have so many pressing needs for what they ought to be focusing both their resources on, but also, staff time and executive management time on. So how do you justify, I mean, think of, and so kudos to Ghana and Rwanda for having started this in a big way. But for a country where the supply management group are focused on just getting supplies in and fulfilling requests, now to set up a new system, it's a somewhat involved business case, investment case to make. So how do you justify a case like that? And secondly, embedded within that is the question, are some of the things that you're doing to resolve these short-term disruptions going to continue beyond? Is Ghana just using Zip for vaccines now, or will it become a mode for emergency delivery even in the future? And same thing for lab testing and things like that. So is this just a temporary phenomenon, or is this going to continue? And if yes, how do we pay for it? How is it sustainable? I'm sure these are questions that that have come to you before, and Zipline has probably reflected on them. So any thoughts and reflections on that?
Sure. In terms of how to balance this versus other investments, particularly right now, I think what we are seeing is that in many instances it actually is an agile supply chain that is the unsung hero of being able to keep care going during COVID-19. I've never seen so much, international discussion about supply chains and some of the interruptions in supply chains as in the last couple months. And I think, supply chain can tend to be overlooked sometimes as a really key part of care provision. And I think that what we're seeing now is that, this is something that can have benefits, in an emergency context. We already have seen that it has benefits in a routine context. But as you think about in moving forward beyond COVID, every country is going to be asked to be doing the most that it can with the least resources. And so how do you actually, potentially have less stock in the system, be able to, be running an efficient and lean supply chain while also still striving for the goal of UHC and health equity? I think none of us want to be abandoning those goals. And so in order to think through how do you do this in the leanest way possible, I think this is an opportunity to be putting this in place where it can be helping in COVID in the short and medium term, and then can be there to be helping to actually do more transformative, efficient supply chain operations in the future. And then in terms of the second question, I'm blanking, Prashant. Can you just bring me back to it?
No, I think that helps the second question as well to some extent. But I think it was more about is this going to continue, and how will it get funded? Will governments be paying for it?
Yeah, right. And so actually, some of the transitions that we were seeing in Ghana were some of the polls of the kind of the beginning thinking of that was actually in place even before COVID. So the EPI program, for example, from the very beginning had said, we recognize that there are some facilities that are just difficult for us to reach, difficult or expensive for us to reach. And so we actually would like to think of Zipline as being the primary supplier to a subset of those. Can we work together to understand what are the facilities where actually this is a more cost efficient or a more sensible approach than us sending a ground vehicle to go be delivering something that actually can fit in a small box. Or requiring a health worker to come and travel and take all of that time and oftentimes personal expense to be going and picking up those items to have an inefficient outcome. And so I think some of that transformation has already begun to come in mind with these health systems, and that was one of the ways why it was able to move forward. And I think if that mindset were to shift, then you could see how there could be many different partners and programs that would be operating in countries that are all currently trying to solve this last mile supply chain solution in parallel with one another, which is an incredibly inefficient way to do it. So you should be actually consolidating different kinds of commodities, different programs. Everyone is trying to reach that same clinic. So how can we be collaborating and actually reducing the marginal cost for everyone to do that? And that helps to make all of this more sustainable in the long run.
Two other questions that have come up from our online chat feed. One is, what is the biggest unexpected impact that you've observed after the launch of the service in Rwanda and in Ghana? And the second is, for a Zipline distribution center to be cost efficient, how many facilities should it be serving? Is there a threshold at which it starts becoming cost efficient? So unexpected impact in Rwanda and Ghana that you didn't foresee before starting, and then something about the threshold at which cost effectiveness is.
Yeah, on the unexpected impact side, I think there it was fascinating to see, this is even in our early years, fascinating to see that when you make products available to health facilities and and remind them sometimes about what's needed to be able to actually administer them, like kind of refresh some of their training, then the demand is there. This shouldn't be surprising to anyone, but all of these health workers really want to be practicing at the top of their license. They want to be doing the best for their patients. And so what we saw in Rwanda concretely was that there was a major spike in the use and demand for specialized blood components. So plasma, cryoprecipitate, and fresh frozen plasma, as a result of Zipline suddenly being able to make those available to some remote hospitals that hadn't used those commodities before because they just hadn't been able to actually go and fetch them by ground transport. They were so scarce that those regional blood centers didn't want to be allocating them because it wasn't, they weren't sure whether actually they were going to make it back in time to the health facility for them to be put to good use. And so previously, those health facilities had only been able to use red blood cells. So by being able to make more specialized products available and being able to provide, actually what is, clinically appropriate care, then those health facilities are willing to embrace that. And that was actually a pretty quick uptick. As soon as you have, make them available, have that refresher training, then they want to do that. And then when it comes to the other question, and sorry again, Prashant.
So I think a category of questions are coming up, Brittany, which are about cost efficiency, and they are, at what point do you become cost efficient? At how many health facilities? What else can be done to improve cost efficiency?
Yep, great. Yeah. So as I mentioned, each one of these distribution centers can serve hundreds of health facilities across the region. We price our service based on the amount of capacity that a health system needs. And so in the instance of Rwanda and Ghana, we priced according to a capacity of up to 150 flights per day. And that is in order for us to be able to actually provide the right number of vehicles and staff to efficiently, adjust and scale up or scale down our service to meet those needs. So it is a sliding scale. There are ways to do this in places that have much more volume and places that have less volume. And I think the answer there is it shouldn't be a one-size-fits-all solution. Some places are going to need 24/7 service. Some areas may need several hundred deliveries per day in that service area. And so by being able to actually kind of dial into what is the most appropriate amount of demand and volume, and then how do you be able to expand that as needed, I think is one way to make that into the most efficient solution possible. But really it is more about the amount of volume that the system chooses to put on the Zipline relative to the current supply chain, the ground-based transport. So there could be actually very few health facilities, but if we're taking all of the products that are going out to those health facilities rather than complementing the existing ground transport, then that may be enough.
Yeah, no, we are almost out of time. One last thing. So there are a set of questions, and I presume some of them are coming on Twitter. So when you get a chance, if you could please reply to them on Twitter if we don't get a chance in the session itself. I think there is a question which is, could you tell us more about how are you doing the delivery of family planning and sexual and reproductive health products in Ghana? Is it more like the emergency deliveries of vaccines? Is it more routine? What kind of demand is it fulfilling? And how do you fit them in a drone? We saw the videos of PPE and other things, but not so much of FP.
Yep. No, great. Yeah, great. So this is going to be a new part of our service, and we haven't delivered family planning products before. It's an area that resonates a lot with me, and I think half of the world's population, hopefully more. But with these products in particular, this is really about recognizing, there are certain services and products that are needed most at the CHIPS level. So that's the lowest level health outpost, essentially, in the Ghanaian health system. They may have a shorter product list that matches the types of services that their nurse or in some instances maybe a community health worker are providing. And so how can we be able to essentially take whatever needs to be on their shelf and be able to deliver it. And so we are going to be delivering things like condoms and oral contraceptives, Depo-Provera. So, these are all part of our what the Ghana Health Service typically provides to those facilities, and we're just going to be basically taking all of that volume and delivering it to them directly, rather than having it be stored at a place that those health facilities actually typically need to go and pick up at, because the ground transport is actually too difficult in that new region in Western Ghana for the regional medical store to be able to proactively deliver to those chips. So it's going to be better service for those health facilities. They'll be able to make sure that they always have access to what they need in case there are spikes in demand, and hopefully it will be a solution that is kind of bridging access and efficiency.
Thank you. We're almost out of time. I know there are lots of questions people have, so we'll do our best to respond to them on Twitter. But thank you again, Brittany. And I also want to acknowledge that there is going to be a stream of op-eds and editorials highlighting how drones have helped in COVID-19 and how they could be used as a platform for future emergencies. One colleague at the Gates Foundation is creating some materials on that. And secondly, there are many other opportunities to continue this conversation. So this was just a start, and we are by no means saying that this solves all of the challenges of COVID-19 medical supply chains. There are so many other things to look at, but at least it is one part of the solution. And if we view that as one part, there are questions that still remain unanswered, and I think it's worthwhile thinking about what those questions are and how do we make sure that both development partners, but also more importantly, country governments such as the progressive Ghana Health Service and Rwanda, how can we learn from their experiences and start communicating them in a faster cycle to other country governments and create that peer learning about their use of drones versus having to come through Zipline or other groups. So those are just some questions I want to end this session on, but thank you everyone for joining and for your questions and comments. Be healthy, be safe. Good luck. Thank you.
Thank you, Prashant.